So some of you may wonder, why would a vascular surgeon come and talk to a group about is interested in heart disease? Well, I'm here to tell you that if you do have a diagnosis of peripheral vascular disease, it could be a warning sign that you have heart disease. And with the diagnosis of peripheral vascular disease, we can help you to try and prevent a future heart attack. So this is an important topic. This is a topic that people need to be more aware of. The American Heart Association has an initiative to increase awareness in peripheral arterial disease, and I hope that you guys will learn about that today. So when we talk about the arteries, so what do? So I treat arteries and veins. I do operations on them from the base of the skull all the way down to the toes, except for the heart. That is Dr. Warrenberger's territory. So the arteries carry the blood out to your fingers, obviously, and the veins bring the blood back to your heart. A lot of times I have people come and tell me that they have varicose veins and they're worried about their circulation. It's really important to remember that varicose veins are generally not a sign that you have poor circulation. Poor circulation generally occurs when you're doing something, when you're exercising. This is when I was a lot younger and had blonde hair.
Peripheral vascular disease is a restriction of blood flow that people can get to their legs, which leads to decreased circulation to the muscles of their legs. There's lots of different causes, but the underlying etiology is either atherosclerosis, or the buildup of cholesterol in the arteries, or some type of inflammatory process. So people who are at risk of getting peripheral vascular disease, it's obviously associated with age. So anybody over the age of 65 has a higher risk of peripheral vascular disease. But the people that are most at risk are smokers, people who have diabetes, people who have high cholesterol, and people who are overweight. All those things are associated with peripheral vascular disease. So peripheral vascular disease is an underlying sign that you may have disease in your arteries in other places, such as your heart or in your arteries in your neck, called your carotid arteries, that could lead to stroke. So people who have peripheral vascular disease have a 3 to 6 times higher risk of dying of a heart attack within 5 years. So because it's a narrowing of the blood vessels within the arteries of your legs, what most people feel when they have symptoms is cramps in their legs when they walk. And so with those narrowings, you're getting less oxygen to your muscles in your legs. And so as you walk, your muscles secrete an enzyme that gives you a cramp. And when you stop, that cramp goes away. If you have those symptoms, those are signs that you might have peripheral vascular disease. A lot of times as you get older, it seems that your activity level decreases. You have aches and pains. And so a lot of people believe that it's just a normal part of aging, where they can't walk the distance that they used to. And a majority of the time, if they talk to their physician about these particular problems, simple things can be done to improve that. And sometimes these problems turn out to be more worrisome, like peripheral vascular disease, in which case, again, those are signs that other problems are going on with blockages in the arteries in your heart, as well as blockages in the arteries in your neck. And so we really want to see those people early so we can prevent death from heart attack and strokes.
This Healthy Highlight is brought to you by Dartmouth-Hitchcock and Ledyard National Bank.
So there's lots of great videos on the Dartmouth-Hitchcock website that I invite everybody to go and see. So does this sound familiar? So I used to go on long hikes with my husband, but now my legs get tired so quickly I can't do the things that I used to do. I don't know what happened to me. I have an awful pain in my right calf after just walking 10 minutes. It feels like someone put a clamp on my leg. When I walk, I get an aching pain like a Charlie horse in my left calf for months. When I go shopping, the pain gets so bad I can only walk about 5 or 6 minutes before I have to sit down. And what's interesting is you look at the age of those people, 54, 60, 65. That's retirement age. So we're thinking that we're going to have a good life, and these things do crop up as we get a little bit older. So if you've heard this before, or you actually say this, you are not alone. So the video introduced you to what peripheral arterial disease is, and basically just like you can get blockages in your arteries in your heart, you can get them in many different arteries, including the arteries in your legs. And so when you get a narrowing in those arteries in your legs, your muscles aren't getting enough oxygen, so you get a pain in your muscle when you walk. And that's just a warning sign from your body telling you that you need to stop. In some extreme cases, when people really don't take care of themselves and they don't listen to their doctors, these diseases can progress. And especially for diabetics, they're at extremely high risk of losing their legs from peripheral vascular disease. The most common signs, as we already talked about, are cramps or tiredness in your leg, and it can sometimes actually even be in your thigh and your buttock. But all of these things have to occur when you're walking. I hear a lot of times from my patients that I get leg cramps at night. That's from something else. This peripheral arterial disease is a manifestation of an action. You have to be moving in order to have these particular symptoms. A lot of times people mistake them for other things. You know, I've been working out, my legs get a little bit tired. I haven't been walking all winter because the snow's been quite terrible. But if this is a consistent and persistent issue, this is something that you need to speak to your physician about. And the most important reason is, again, because people who have the diagnosis of peripheral arterial disease have an increased risk of having asymptomatic carotid disease. So what does that mean? That means that you're not having any chest pain or shortness of breath, but you do have blockages in your arteries. So we as physicians can help you modify your health and modify your risk factors to hopefully prevent a future heart attack and or stroke. There's a large study to look at what is the incidence of peripheral arterial disease in the population. And what they found is patients going to their regular primary care doctor as a follow-up, 1 in 3 patients had peripheral arterial disease. Now here's the scary fact, is despite the fact that you as a patient knew that you had peripheral arterial disease, your physician only 50% of the time knew that you did have that diagnosis. The harder thing is that those people who were diagnosed with peripheral arterial disease didn't always get the appropriate medication treatment, like people with coronary artery disease. Everybody knows if you have coronary artery disease, you should be on an aspirin, your blood pressure should be well controlled, you should be on a cholesterol-lowering medication. But when people have just the diagnosis of peripheral arterial disease, not all primary care physicians put them on the appropriate medications. So again, what is the incidence? And here's the scary thing that I think every woman in this room really needs to pay attention to. As we get older, we outnumber men in the incidence of peripheral arterial disease, especially over the age of 70. So what are the risk factors? Diabetes is a significant risk factor. So if you have diabetes, you have a 22% incidence of having peripheral arterial disease. Even if you just have glucose intolerance, where your doctor has tested you and you're not currently on medications, but they find that your blood sugars are a little bit high, you still have about a 20% increased incidence of having peripheral arterial disease. Other risk factors are smoking. I don't think anybody in this room probably smokes, so I don't have to stand on the podium and tell people how bad smoking is. Diabetes, high blood pressure, high cholesterol, these are all known ones. But what's interesting is a new known risk factor is coming up, and that's just inflammation. So there's been a number of studies to show that if your body has an increased inflammatory state, even if you have normal cholesterol, you can have an increased risk of heart attack and stroke in the future. So again, based on good evidence, people who are at risk at peripheral arterial disease are people who have diabetes, who smoke, have high cholesterol, high blood pressure, people between the age of 50 and 69 that have a history of smoking or diabetes. Anybody over the age of 70 is at risk of having peripheral arterial disease. Obviously, people with symptoms, on physical exam, if you can't feel pulses, then you are at risk of having peripheral arterial disease. And if you have a diagnosis of heart problems or kidney problems or even problems with stroke, you're at risk of having peripheral arterial disease. There are certain risk factors that we can't change. We can't change the fact that we're all getting older. We can't change what gender that we are, and we certainly can't change our family history. African Americans and American Indians have an incredibly increased risk of having peripheral arterial disease. But there are risk factors that you can change. Smoking is the biggest risk factor. Physical activity, increasing your physical activity is important. I think Dr. Andrus talked to that this morning. Having high cholesterol, high blood pressure, diabetes, and being overweight. Other factors that could be modified as well as stress and your inflammatory state. So on average, smokers are diagnosed with peripheral vascular disease as much as 10 years earlier than non-smokers. So I've been here about 15 years, and the average age of my patient that I generally saw was around 70. Now it's around 40, 45, 50. So it's gotten to be a lot younger that we're seeing people with these types of problems. So the good news, though, is that if you stop smoking, you're not going to change the amount of disease that you already have, but you could stop the progression. By the way, if anybody has questions along the way, please raise your hand. I'm happy to answer them. Yes, ma'am.
When diabetes is a risk factor, does that mean uncontrolled diabetes or controlled diabetes?
Yeah, unfortunately, even controlled diabetes can be a risk factor for progression of atherosclerosis. But the problem is that that's one of those risk factors that we can't necessarily change. We can modify and improve, and so we can slow progression for those people.
And is that true for type 1 as well as type 2?
Yeah, so type 1 diabetics generally are diagnosed younger, so they have so we see those patients with worse disease earlier on in their age. But yes, it can be for both. Yes, ma'am.
Could you explain tests for measuring inflammatory?
Yeah.
What
Yeah. So it's something called C-reactive protein. It's a little controversial, and I think that some cardiologists and primary care physicians don't necessarily believe in it. But there was a large study that showed that if your C-reactive protein was elevated despite normal cholesterols, you benefited from modulation of your inflammatory status. And in that particular study, they used statins to decrease your CRP levels. So what's the natural history of peripheral arterial disease? Everybody wonders about this because everybody's always afraid, well, I'm going to lose my legs. Yes, ma'am. It actually is. So not only does it lower your cholesterol, but it inhibits a particular enzyme. Just like Dr. Lukovitz showed that there's this cascade. A lot of times if you inhibit one thing, it affects a lot of different things. And so there's lots of good research to show that it is an anti-inflammatory. So whenever I see somebody with peripheral arterial disease, their first question is, am I going to lose my legs? And the answer is generally no, especially if you take control of your health and you follow your physician's instructions for a risk factor modification. But the scary thing is that, again, it's a sign that you have disease someplace else. You have an increased risk of heart attack and stroke. So this is just a graph to illustrate that. So in the normal population, you can see that over 10 years, your risk of dying is about 10, 20%. If you have no symptoms, but you have peripheral arterial disease, your risk of dying considerably increases. People with symptoms of peripheral arterial disease, where they have pain in their legs when they're walking, so at 5 years, just like we said in the video, 50% of those people could die from coronary events. So this is a considerable risk. This graph shows, again, survival, risk of heart attack, and then risk of amputation. The risk of amputation is way down here. But your risk of a heart attack is up here, and your risk of dying is up here. So the important thing whenever I see somebody with peripheral arterial disease is to talk to them about all those modifiable risk factors. No smoking, take an aspirin, exercise, eat well, all the things that you're learning today that are important to stay healthy. So what's the good news is that, again, peripheral arterial disease is easily diagnosed. It's basically comparing the blood pressure in your leg to the blood pressure in your arm. It can be done in the office. It's a very simple test. It's easily diagnosed. And again, this is a wake-up call that if you get this diagnosis, you need to try and be as healthy as possible.
Well, why don't doctors do that? I've never had my blood pressure taken.
Yeah, so generally a doctor wouldn't do that unless you complained about it. And on physical exam, if they're able to feel your pulses, then the assumption is that the blood pressure in your leg is probably the same as the blood pressure in your arm. I would assume that if you didn't have a pulse in your foot, then that would be a simple test that the doctor can do in the office. And we have to remember that we are our own best advocates as well. So if you think that you might have it, it's a simple test that the doctor can do for you. And again, this is all you need to do. You take your blood pressure in your arm, you take your blood pressure in your leg, and they should be equal. If the blood pressure in your leg is less than the blood pressure in your arm, you probably have some blockages in your arteries. Sometimes you can the blood pressure in your arm and the leg can be the same, but you still have pain in your leg when you walk. And that's because when you have a narrowing in your blood vessel, if it's around 50%, when you're sitting and we're taking your blood pressure, it's probably not significant. But when you're walking, that narrowing, which may not be that bad when you're just at rest, becomes bad when you're walking. So what we have people do is walk on a treadmill. And when they get the pain, we check the blood pressure in their arm and leg again, and it helps us to make the diagnosis of peripheral arterial disease versus lots of other things. People can have pain in their legs for many different reasons, but this is, again, a simple test that we can do to try and make the diagnosis. So what can you do? Let's say that you have this diagnosis. Your doctor has told you that you have blockages in your arteries and you're having pain when you walk. Well, the first thing that we'd actually tell you is to walk more. There's very good evidence that the more you walk, the more you will build something called collaterals, or these tiny little side roads, to improve your circulation. That won't make the blockages go away, but it may be able to increase the distance that you can walk. There are hospitals that actually have training programs. We put people on treadmills, and we have them walk, and we set them at a certain speed and a certain grade. And you have to be able to walk for more than 10 minutes at that grade and speed. And if you do that, you've accomplished your goal. And as we increase the grade and the speed, you're able to walk farther and longer. And so the goal is for you to be able to walk 50 minutes on a treadmill at the appropriate grade and speed that you feel comfortable with. And that should be done at least 3 times a week to try and improve your walking distance. There was a study that actually showed that if you put people on these regimented exercise programs, they can increase their walking distance by 50%. Now it's not, so remember that sometimes people can only walk 100 yards, but still, that's twice as much, and that may be just enough for them. There are certain medications that we can also prescribe. In the past, it was something called Trentol, but what we found was that there really was not considerable benefit. Now there's a newer medication called Cilostazol or Platol. So the mechanism of action of this particular drug is to try and make your blood vessels a little larger, so whatever blood is going past the blockage squeaks by a little bit better. It will not make you perfect. It doesn't make the blockages go away, but in about 1 of 3 people, it can get you walking 50% farther. With any medication, it's got side effects because it doesn't just affect the blood vessels in your legs, it affects it in your intestines and in your brain. So sometimes people can have a little diarrhea and headache, which generally goes away in a couple of days. Sometimes it gets to the point where people come to us and say, I can't do the things I want to do, I can't work, I can't take care of my infirmed spouse, I need to be able to do what I need to do. And so we have to think about options. And one of the options is something called a bypass. So it's just like plumbing. If you have a blockage in a pipe, you have to either remove the pipe and replace it or go around the blockage. And so what we basically do is we find a spot where the artery is good up at the top of your leg and find a spot where the artery is good down below, and we connect the two. And so it goes around the blockage, it's a bypass, and it restores your circulation to, as best as we can, hopefully back to perfect. As you can imagine, any of these types of operations are big. These are big deals, and there's lots of risks to these operations, including dying, amputation, major complications, and sometimes people don't actually return to their independent status that they normally would. And in ideal circumstances, so for us to get a perfect outcome, it only occurs in about 20% of times for bypasses. So with those types of results, we have to think about other things to do. These are very invasive procedures. We have to make incisions going all the way down people's legs. And so people started to think, well, are there other ways that we can do this that are lesser invasive and hopefully have similar, if not better, outcomes? So just like you can do angioplasty and stenting in the heart, we can do it in the legs. There's all kinds of different stents that we can put in the arteries in the legs. And this is just a picture where we put dye into the artery, into the leg. This is the femur, so this is the thigh. And this artery, the main artery that's going down to your leg in this person, is completely plugged up. And we're able to restore the blood flow by placing a stent inside the artery. And this is just a cartoon graphic of some of the stents that we use. That can actually restore people's circulation back to 100%. The day that we do the procedure, they're able to walk farther. They're able to go back to work in 3 days. It, for a lot of people, is a considerable change to their quality of life. The issue, though, is that sometimes people's arteries, as you saw in that prior picture, are considerably diseased, and some of the stents that we use can't really work very well. And so we have to make a space for the stents to expand within the artery to be able to restore the blood flow. So the nice thing about vascular surgery, and one of the things that I really enjoy the most, is the technology. The technology has really expanded what we can do for people. And one of the things that we use is a laser, which basically pulverizes the stuff, the buildup inside your artery, and it allows for a channel to form so that that way we can put a stent in and restore blood flow. This is another device that we use if the artery is very, very diseased, where we actually mechanically remove. People talk about the roto-rooter. Well, this is similar to that type of a device where we basically shave all of that stuff that's inside of your artery and remove it, and then replace a stent to allow for the artery to stay open for longer. This is a picture of some of the stuff that we take out. Yes?
Black out when you do that? Or
Yeah.
is it just sort of free floating?
So this particular device, what happens is that as you're shaving, this stuff builds up inside of the catheter. And so we have to actually pull it out once it gets full and empty it and then go back in and do a little bit more. But that's a good question, because what we actually found is that, well, you can imagine that if you have stuff inside your pipe and you start cleaning it off, little pieces fall off. Well, what happens to those little pieces? Well, most of the time they're small enough that it doesn't do any damage and it doesn't hurt your circulation. But this was, for a while we used these little baskets that we put past where we were working on the arteries. And this is the stuff that we pulled out of those baskets. So even though it's a lesser invasive procedure, it's not without risk for these types of things to happen. We have all kinds of different stents now. Some of the stents have material covering them, so it basically relines the arteries, because just like in the heart where the stents can get reblocked, the stents in the legs can definitely get reblocked again. So this is a newer technology that we're looking at to see if we can prevent these reblockages to occur because of these fabric-coated stents. And this is my favorite. So sometimes people's arteries are completely plugged up. There is absolutely no way that we can push anything through all of that stuff. And so what we basically do is we make a channel with a wire next to the stuff. And we use this little device that we then push through, and a needle pokes out past all this stuff. And you can sort of see here, this is the device with the needle. And what's really cool is that this catheter has an ultrasound at the end of it. So what we do is we push it past, and then we use an ultrasound to try and find where the real blood flow is. And we aim that needle at that real blood flow, and we shoot the needle out into the real blood flow, and a wire goes into the real blood flow. And so now, you can see we've gone past all of that stuff, and we have a wire where the artery is good again, and we can basically just reline that whole artery again. We can use our laser. We can do whatever we need to do in order to get past all these complete blockages in arteries. So it's pretty cool.
That's something that stays in the body.
So this catheter comes out. What stays in is the stent. Yep, so basically the stent pushes all that stuff off to the side. Sometimes in the last 10 minutes, I'm going to talk to you about some of our newer things that we are doing here at Dartmouth for those patients that really don't have a lot of options. So sometimes disease in the artery progresses to the point where they're at risk of losing their leg. They get gangrene, they get ulcers on their feet that are non-healing, they get pain when they're just sitting. And what's scary about this is that those patients sometimes don't have a lot of options. And in fact, if you look at a population of people that have this, something called critical limb ischemia, in 6 months, 20% of them will die of a cardiovascular event. 35% will be alive, but they'll have lost their leg, and only 45% will be alive without an amputation. So this is a scary number for a lot of people, and it's something that they may not be aware of. People are afraid of cancer, but peripheral vascular disease is a pretty devastating disease. So for those people that can't get bypasses and can't get stents and we can't restore their circulation, here at Dartmouth we've tried a number of different options. What we're trying to do is actually grow new blood vessels for people. So what we do is we take bone marrow out of your hip. It's a procedure that can be done when you're awake. You go home the same day. And what we do is we take certain cells out of that bone marrow, and we try and what we do is we isolate those cells that we think will grow new blood vessels, and we inject them back into your leg. There's lots of different studies to show that these bone marrow cells can be made to do lots of different things. They can be made to restore muscle, to restore cartilage. In fact, some of the orthopedic surgeons are using it to rebuild knees. So again, what we did a study here. It's a randomized trial, which means that people volunteered to do this, where they either got placebo, so not the good stuff, or we took bone marrow and we spun it down in this fancy centrifuge. We isolated the cells that we think grow new blood vessels, and we inject them back into their legs. So this is the preliminary results, and we've now done a number of different trials here where we've tried to grow new blood vessels for people, and the results are really the same. What we find is that there's a 50% improvement in everything. So everybody in this study was at risk of losing their leg, 100%. So we were able to reduce that amputation rate by 50%. 50% of the people had improved pain. 50% of the people had decreased disability. So it really does have a significant benefit. So what we found was that for some of the trials, it was temporary. That what happened is these blood vessels regressed. And so now what we're doing is we're doing a study where we're doing it on a regular basis. We're having them to have the injections for 4 weeks. We give them a little break. They come back and they do injections for 4 weeks, and we give them a little break. And I can tell you that I'm very impressed with those results. So what do you need to know about peripheral arterial disease? If you have pain in your legs when you walk, you need to tell your doctor. It's really important because, again, we can do certain things to risk factor modify to hopefully decrease your risk of future heart attack and stroke. And the most important thing is to just listen to all the speakers today. Be as healthy as you can, eat well, no smoking, take your medications. The optimal treatment ranges for medications to exercise program to all of these fancy things that we have. And in our hands, we have good results. We don't always have the best results, but we certainly try to improve people's quality of life.